Put 100 baby girls in a hospital nursery, and the matching number of boys will usually not be 100. It will be about 105. The difference is small enough to miss in a single family, a classroom, or even a small town. Across millions of births, though, it appears again and again. Human births lean slightly male. That means roughly 51% of newborns are boys and 49% are girls. Not 60-40. Not a dramatic imbalance. More like a coin that lands on one side just a little more often. The obvious question is why a process built around X and Y chromosomes does not produce a perfect 50-50 result. An egg almost always contributes an X chromosome. A sperm contributes either an X or a Y. In the typical pathway, XX leads to female development and XY leads to male development. Although human sex development has rare variations and involves more than 2 letters. At first glance, the arithmetic looks simple. About half the sperm carry X, about half carry Y, so the result should be even. This is where an old myth usually enters the conversation. Y-bearing sperm are often described as tiny racing machines, faster, lighter, but less durable. X-bearing sperm are supposed to be slower and tougher. From that story come calendars, special diets, sexual positions, and careful timing around ovulation. The problem is that reliable human evidence does not support a simple race in which Y sperm consistently win because they are faster. A kitchen calendar is not a sex selection device. The crucial detail is that the ratio at fertilization is not necessarily the same as the ratio at birth. Between those 2 moments lies pregnancy, and pregnancy is not a neutral waiting room. Embryos and fetuses of the 2 sexes differ slightly in gene expression, growth, metabolism, placental development, and vulnerability at different stages. Researchers sometimes use 3 different snapshots. The primary sex ratio refers to the ratio around conception. The secondary sex ratio is the ratio among live births. Later, the ratio in children or adults changes again because mortality and migration affect males and females differently. These numbers describe different checkpoints. Mixing them creates a lot of bad explanations. A large study published in the Proceedings of the National Academy of Sciences in 2015 tried to reconstruct the journey from conception to birth. The researchers combined information from embryos only a few days old, prenatal tests, fetal deaths, abortions, and live births. Their conclusion was surprising. The ratio close to conception appeared roughly balanced, not strongly male-biased. Then the line moved. In the earliest part of pregnancy, male losses may briefly be higher. During much of the first trimester and into the second, female losses appear to be higher, so the proportion of males rises. Later in pregnancy, male fetuses again show greater vulnerability. Add the stages together, and the final result is still a modest excess of boys among live births. That is a much messier answer than male sperm swim faster. It also means there is no single moment when nature simply decides to make extra boys. The birth ratio is the final score after several stages, and the advantage can switch direction along the way. Why would female embryos be lost more often during part of early pregnancy? Scientists do not have one complete answer. One possibility involves the X chromosome. Female embryos usually have 2 X chromosomes and must silence most of one copy through a process called X chromosome inactivation. That is normal development, but it is also a complicated piece of biological regulation. Differences in how genes are switched on and off may affect survival at very early stages. Male embryos have their own problem. They usually have only 1 X chromosome, so there is no second copy of many X-linked genes to compensate when something goes wrong. Male fetuses also tend to follow a somewhat faster growth strategy. Faster growth can be useful under good conditions, but it can demand more from the placenta and leave less room when oxygen or nutrients become limited. This helps explain why male fetuses and newborns are often more vulnerable later in pregnancy and around birth. Picture 2 engines tuned differently. One may accelerate harder but tolerate a bad fuel supply less well. That metaphor only goes so far, but it captures the basic point. Male and female development are not identical versions of the same process. A neonatal ward shows the later part of this pattern in a very ordinary way. Premature boys, on average, face higher risks of several complications than premature girls born at the same gestational age. Doctors sometimes refer informally to a female survival advantage. It is a population pattern, not a prediction for one baby. A healthy boy can do perfectly well, and a girl can be seriously ill. Statistics do not examine the child in the cot. This creates a tempting evolutionary story. More boys are born because more males die young, so nature produces spare boys to balance the population. It sounds neat. Too neat. Evolution does tend to push sex ratios toward equality. If one sex becomes rare, individuals of that sex will, on average, have more opportunities to reproduce. Genes that increase production of the rarer sex can then gain an advantage. This idea is often associated with evolutionary biologist Ronald Fisher. It explains why wildly uneven ratios are hard to maintain in many sexually reproducing populations. But Fisher's principle predicts a balance in reproductive investment. Not a little accountant inside the body counting future traffic accidents, infections, wars, and heart disease. The slight male bias at birth may contribute to a more even ratio near reproductive ages, but saying it evolved specifically to compensate for male deaths goes beyond what the evidence can firmly prove. The biological mechanisms and the evolutionary explanation are related, but they are not the same question. By adulthood, the nursery imbalance has already narrowed in many populations because boys and men tend to have higher mortality at numerous ages. Later, women often outnumber men, especially among older adults, because women generally live longer. So the ratio is not fixed. It drifts across the human lifespan. Now take a family with 3 sons. The parents may hear that they only make boys, as though one of them owns a defective coin. With a roughly 51% chance of a boy at each birth, 3 boys in a row is not remarkable. It happens to around 1 family in 8 under a simple independent model. 4 boys in a row is less common, but still ordinary when millions of families are involved. The same logic works in reverse. A maternity unit can have a week with far more girls, even though the national ratio remains slightly male. Small samples bounce around. 5 births are gossip. 5 million births are demography. Can stress, famine, pollution, parental age, season, disease, or war change the ratio? Researchers have reported associations with many of these factors. Some studies find slightly fewer boys after severe population stress, which could fit the greater vulnerability of male fetuses later in pregnancy. Other studies find different patterns, weak effects, or no effect after better controls are applied. And yes, this gets messy fast. Even when a factor is real, the shift is usually tiny. It may move a population ratio by a fraction of a percentage point, not let a couple choose the sex of their next child. Claims that a particular breakfast, moon phase, supplement, or day of intercourse can reliably produce a boy or a girl are not supported by good evidence. There is one important exception to the biological story. In some countries and periods, the recorded ratio at birth has risen far above the usual range of about 103 to 107 boys per 100 girls. Biology alone is not a convincing explanation for persistent values such as 110 or more. Those patterns can reflect prenatal sex selection driven by a social preference for sons. That distinction matters. A ratio near 105 is a common biological pattern. A much larger and persistent imbalance may be evidence of human decisions, discrimination, incomplete registration, or poor data. The number looks similar on a chart, but the cause can be completely different. So why are more boys born than girls? The cleanest answer is not that Y sperm are heroic sprinters, and not that nature deliberately orders extra sons. Fertilization appears to begin close to 50-50. During pregnancy, male and female embryos have different patterns of survival at different stages. Those small differences accumulate, leaving about 105 boys for every 100 girls at birth. Then life starts changing the ratio again. The number in the nursery is not a rule for a family and not a guarantee for the next pregnancy. It is the faint statistical fingerprint of millions of conceptions, losses, births, illnesses, and survivals. Up close, every birth is unpredictable. From far enough away, the pattern becomes visible.
Thanks for watching! If you enjoyed the video, please like, subscribe, and leave a comment below. See you in the next one!